I'm Oscar Jimenéz-Solomon, a research scientist at Columbia Psychiatry. My research focuses on how social economic factors such as poverty and financial hardship affect the mental health of communities. My goal is to help develop programs and identify the kinds of policies that can help tackle poverty and economic inequalities as they affect mental health. Different forms of financial hardship seem to affect mental health. One of the most important ones seems to be indebtedness. When people experience have too many debts, people experience the inability to repay their debts and feel that their level of debt is just too much for their income. What that seems to create is a sense of being trapped, sense of shame, feeling like one is a loser or a failure. And for many people, that brings about the thought that suicide is the only way out. Shame and isolation can be paralyzing. When we are in the midst of shame and feeling isolated, it can actually block us from being able to take the very basic actions to help our financial situation, to open the envelope, to pick up the phone call, to reach out to the services and the resources that are available in our communities. In New York State and in other parts of the country, we have a very growing workforce of peer supporters who have not only the lived experience, but have the training. That is an untapped workforce that can help us address the financial difficulties that many individuals are having. And this is the one way in which peer support can help. Peer support can help us step out of that isolation and help us navigate the resources that are available. And one other important way is that when we hear from someone who has the lived experience, what they've done, what resources they've used, what strategies they're actually utilizing to overcome their financial difficulties, we may actually listen more carefully because that person has walked through those shoes and knows what they're talking about and has actually experienced it themselves. Policies like the minimum wage and the earned income tax credit can reduce inequalities and improve the mental health of communities. One of the ways that we know this is because of the research that has been done around minimum wage and also the earned income tax credit. A $1 increase in minimum wage has actually been associated with a 6% decrease in rates of suicide among those who have high school education or less. Another important policy that has been studied significantly is the earned income tax credit. We know from the research that a 10% increase in the earned income tax credit is also associated with a 3% decrease in rates of suicide, which is significant. Research in the earned income tax credit area has also shown that increases in the earned income tax credit, especially by states that provide more generous EITC benefits, can also decrease psychological distress, depression, and can also improve the self-esteem, especially among mothers with children. One thing that I hope that people can take from the research that we have is that treating mental health symptoms is important and essential, but it is not enough when people are experiencing poverty and financial hardship. It's also really important to, in fact, treat the root causes of those mental health problems, the poverty, the financial struggles that create feelings of depression, anxiety, shame, entrapment. There are policies such as the earned income tax credit, minimum wage. There are other programs that we can implement within our mental health systems to help people resolve their financial difficulties and find hope and also just regain their humanity.